Alright, so let's talk about this case from Radiopedia.com. So we have a 70-year-old male who has a previous bowel cancer, and he did a bowel resection with radiotherapy. And he decided that this patient should be done a pH chest X-ray. What is the abnormal finding that you can find in this imaging? You can pause the video and let me know what you think. Of course, the abnormal finding that can be seen here is that there is a rounded ossified lesion that is present within the right hilum of the right lung field. And what that means is that this right ossified lesion, what this means is that this might be more than likely a cause of a solitary pulmonary nodule. And of course, if there's a solitary pulmonary nodule, you might think it's benign or you might think it's malignant. Now, before we continue on, everything else is normal. You can see the dome shaped of the right and the left hemidiaphragm, they're fine. The claustrophrenic angles, they're fine. The lung parenchyma overall, it's fine. The ribs are fine. Everything here is completely normal, including the mediastinum. It's just that within the right hilum, we have a right rounded ossified lesion present within the right hilum. And if you notice, you can notice some of the pulmonary blood vessels, they are fine. The pulmonary blood vessels, and especially the mediastinum, they're fine. It's as if we have a lesion here, but this lesion is not part of the hilum itself. It's as if we have a nodule or a lesion that is anterior or posterior to the hilum, and it's not within the hilum. So what does this information mean to us? It means that we should not confuse this with hilar lymphadenopathy. There's nothing here suggestive of hilar lymphadenopathy because the pulmonary blood vessels, they're spreading out just fine. They're almost unaffected. The mediastinum is completely unaffected. If that's the case, then we don't have a mediastinal mass within the middle or a middle mediastinal mass. We more than likely have a nodule here that is anterior to the hilum or posterior to the hilum without affecting the hilum itself. And if you recall, the hilum is composed of many pulmonary blood vessels that are branching out. So if we have the hilum is intact, but we have a nodule, a nodule within the area, then this is known as a hilum overlay sign. And a hilum overlay sign just tells you that we have a lesion that's not within the middle mediastinum, like hilar lymphadenopathy. It's a lesion or a nodule that is either anterior to the hilum or posterior to the hilum. So where is it exactly in the lung? It could be in the middle or the lower lobe. That is why we should order another view, the lateral view. Now, which lobe of the lung is this nodule located at? This lesion is located within the right lower lobe. If you can imagine the oblique fissure, if you can imagine it a straight line, not a straight line, but an oblique line, obviously the line below it, next to the spine, should be the lower lobe of the right lung field, which is this big nodule. So we have a nodule, a pulmonary nodule, present within the right lower lobe and is projecting through the right hilum, but without anything affecting the pulmonary blood vessels. This is known as a hilum overlay sign, suggestive that this mass is either anterior or posterior to the hilum. So they took a biopsy because, if you measure the size and all that, especially if you compare to a previous chest X-ray, if you take a biopsy when you have suspicion of malignancy, then you might assume it's malignant, and this turned out to be a case of adenocarcinoma, which is a malignant lung cancer type. So the features here are of a solitary lung lesion at the right hilum, proven to be adenocarcinoma after biopsy. So what did we learn here today? We learned that if you ever see a solitary pulmonary nodule and you see it was in the hilum, don't confuse it with hilar lymphadenopathy or hilar adenopathy. Always check the nearby mediastinum as well as the pulmonary blood vessels. If it's not affected, that is known as hilum overlay sign.